Cone Health signs a management services agreement with Carolina's healthcare system. We'll explain what that's about. Plus, we'll tell you why the gift of a simple weighing scale can make a big difference in the care for our patients. Those stories in this month's Cone View. Cone Health has signed a management services agreement with Charlotte-based Carolina's healthcare system. This is not a merger, and Cone Health remains an independent organization run by its own board of trustees. The agreement takes effect October 1st. Tim Rice, Terry Aiken, Ken Boggs, Mary Jo Cagle, and Teresa Broderick will become Carolina's healthcare system employees, but remain focused on Cone Health.
We want employees to understand we're doing this from a position of strength. We're a well-performing organization, so it's not like we're hurting and have to reach out for help. So I want employees to continue to do what they've always done, which is to provide exceptional care for our patients.
Carolina's healthcare system manages, owns, or leases more than 30 affiliated hospitals and academic medical centers, representing approximately 48,000 employees. Cone HealthLink hits a major milestone with the biggest round of go-lives yet. Women's Hospital, Annie Penn Hospital, and MedCenter High Point convert to the electronic medical record system July 7th.
I'm very excited for it. I think it's going to make things a lot easier around here. Everybody I've talked to is looking forward to it.
And it'll be better when you present yourself to the hospital. You won't have to worry about, well, I went to so-and-so's office and I don't have that information and everything. So it's going to be a great opportunity for us and a great opportunity for our patients.
My children can have integrated technology into their lives. We have not in medicine. This is a massive jet rocket propulsion into the speed of technology of my children. We'll figure out how to do it. They've convinced me we can.
We can spend more time with the patients, charting their mobile computer so we can turn them around, face the patient, ask them questions, do charting as we're talking with them. It also pulls up pertinent information about the patient and their history that we may not see otherwise, so it allows us to get to know them quicker and know what's going on with them.
I think it's going to be great. It may be a little bit of a challenge in the beginning, but I think for our patients, having everything on one screen and constantly being updated, so we're constantly in contact with our charts, they're going to be a lot safer for our patients and a lot easier access for our nurses to have computers right at the bedside.
Going paperless and a good technology advancement is exactly what we need. We're a magnet facility. This is the way we should go. Patients will benefit from it. Nurses will benefit from it. I think the whole system is going to benefit as a whole from this. So it's going to be a great contribution to what we have.
Hopefully, big changes will soon start at Annie Penn Hospital. Cone Health has asked for state permission to spend $7.7 million to rebuild the intensive care unit and change 27 patient rooms to match those done in the first phase of the project.
We created a virtual room and our staff tested out the efficiency factor of where do you want to place equipment and does it make sense for, what location in the room you want your monitor to be and where you want to document and things of that nature.
If this plan is approved, work should start about this time next year and be finished in the fall of 2014. Check this out. You probably see a new shiny Carelink ambulance. Carelink sees all 3 Cone Health values sitting on a super heavy-duty truck chassis. The newest part of the Carelink team cares for patients with special surfaces that leach silver ions when touched, killing germs. It helps care for each other by being the first ambulance in North Carolina with 4 airbags in the back to protect the crew and the patient. It also has a system to automatically load patients.
It saves on your back and it saves on the amount of injuries you have from daily stress of picking up several hundred pounds over and over.
The ambulance also cares for the community with a lower polluting clean diesel engine. A new employee pharmacy opens July 11th. We caught up with the crew and they were preparing the pharmacy at Wesley Long Hospital. The pharmacy is near the Elam Medical Building and will also have a strong focus on serving patients from the emergency department and the Cone Health Cancer Center.
With the convenience, especially for discharges, things like that, you don't have to go home or stop at a pharmacy on the way home from discharges, things like that. You can get it while you're here.
This is the third Cone Health employee pharmacy. Few of us enjoy pulling out the scales, but for people with heart failure, gaining weight may be a sign they need prompt medical attention. So volunteers at Moses Cone Hospital are providing scales to heart failure patients who need them.
We find that patients are not weighing themselves because they don't have access to scales at home. And it may be, it seems an issue of financial resources. Many times these patients are on a large number of medications, and even if they do have insurance, they have a large number of co-pays to get their medications. And so just adding the expense of a scale sometimes is a deterrent for them to actually be able to do this.
The scales are purchased through the Magnolia Gift Shop. The women's only 5K walk and run takes place October 6th. If you want to be among the 3,500 women who run the 5K, here's your chance. The Women's Only Running School opens July 16th. The first session is from 6 to 7 p.m. in the Women's Hospital Education Center. The 10-week program is designed to get you running and costs $65. Cone Health employees get $50 back once they complete the Women's Only 5K walk and run. With meals to track, computers to debug, and buildings everywhere to fix, how do the people at Cone Health Service Response Center stay focused and on the court? They play. Susan Boyd saw some packing material, thought of how much fun it would be, and thought the rest of us might enjoy it too.
If it's broken, if it's hungry, if it needs to be cleaned, this is the department that all of those items and needs come to. And so we need to play every once in a while.
Susan sews the bean bags and has offered them to other units across Cone Health. This simple game of Tic Tac Toe has ended up in the emergency department of Moses Cone Hospital, E-Link Critical Care, Cone Health Link, and other places as a great way of relieving stress. That's it for this edition of Cone Health. I'm Doug Allred. This is Jack. In a magical place where lives are saved every day, all eyes focus on one prize, top decile performance, AAA.
If we're really serious about taking our performance to that level, if we really want to achieve that vision of national leadership, we have to make a change.
The change is coming. Can you step out onto the court?
How can we ever achieve top decile patient satisfaction, top decile quality scores, if our employees do not love coming to work every day?
The change is already here. Celebrate August 28th, 29th, and 30th.
Live the values.
Ask your supervisor to register you for the People Excellence Celebration. Don't wait. The countdown has already begun.
Don't you get the sense that something's a little bit different?